Tonight, the state reports 1,456 new COVID-19 cases. That's up more than 130 cases compared to yesterday, and it's more than double the 21-day average. The state also reporting 80 new hospitalizations in the last 24 hours. The CDC is now tracking the level of COVID transmission in counties across the U.S. Yesterday, Ohio was considered a yellow state, meaning every county was seeing a moderate level of transmission. But that all changed today. Now, 4 Northeast Ohio counties moved into orange, and that's not good. Marissa Sines reports tonight on why that changed so quickly.
Just a matter of hours, this color-coded map darkening closer to home. Lorain, Erie, Ashland, and Carroll counties reaching what the CDC calls a substantial level of COVID-19 spread. Just 24 hours ago, all Northeast Ohio counties considered to be in a moderate state.
I was a little surprised because our number isn't actually 50 per 100,000, but we're actually just under, though. It's like 49.
The CDC tracks and updates the data based on the number of new cases per 100,000 residents and the percentage of positive tests within a 7-day period. Lorain County's Health Commissioner Dave Koval says cases have been rising as the Delta variant continues to spread.
As the Delta variant moves in, we will continue to see more cases among the unvaccinated. Most counties up here in the Northeast Ohio have a pretty good vaccination rate, including Lorain County.
We looked at the vaccination numbers, and according to the CDC, the percent of those fully vaccinated stands at 33% in Ashland County, 48% in Erie County, nearly 35% in Carroll County, and 50% in Lorain County.
But when comparing counties in blue on the color-coded map, like Holmes County, the CDC's vaccine data shows that 14.2% of the residents there are fully vaccinated.
Some folks who are getting mild symptoms of COVID aren't actually going to get COVID tested. And so as that happens, you'll get less cases in that particular case.
We asked Ohio's Department of Health how they're mitigating the rise and are waiting for a response. A spokesperson for the governor's office sent a statement which reads, quote, "The Ohio Department of Health has a team which tracks these numbers daily. Getting the COVID-19 vaccine is still the best way to protect yourself and loved ones from COVID," end quote. That's a message echoed by Koval.
I can't say it loudly enough. People need to go get vaccinated.
Marissa Sines, 3 News.
Diving deeper into those numbers, as of today, 80% of the COVID cases tested at university hospitals is the Delta variant. That's according to Dr. Claudia Hoyen. She's a pediatric infectious disease expert at UH Rainbow Babies and Children's Hospital. Now, keep in mind, just 2 weeks ago, Delta accounted for 42% of cases in UH labs. It just goes to show how quickly the variant is spreading.
Depending on the population you looked at, we were like at 2% or 10% or what, now 8 weeks later, we're at 80%. I mean, we're going to be at, close to 100 very, very soon.